hear this because, this is a serious condition that people live with and suffer, and it can be debilitating at times, and people can lose days of work, which result in loss of income, and really a lot of challenges. So where I come into play with all of this is I have a first cousin named Crystal Purnell. She's a respiratory therapist down in Georgia. And a couple of years ago, she was diagnosed. And, it's funny how you hear about people being diagnosed with conditions and it just kind of goes in one ear and out the other. I'm going to be honest with y'all, even as a healthcare professional. Really went in one ear and out the other. And we hear my mom sometimes say, oh yeah, Chris is in the hospital, she's sick. Again, one ear and out the other. This was a couple of years ago. No desire to do anything about this. No desire to increase my knowledge. I first came in contact with lupus when I was in pharmacy school at Hampton University. And lupus was one of the conditions that we had to cover in a class that we take called drug disease management. Okay, so we start studying lupus. What stood out to me the most was one of the characteristics, which is the butterfly rash on the face. But I'm gonna be honest with you, in pharmacy school, I liked things that dealt with the heart. I liked infectious disease. When it came to, we had to learn about like hormones and contraceptives and feminine, medications and things like that. I checked out in that portion. I did enough that I needed to do in order to get my degree, but it just wasn't something that I was interested in. And to be honest with you, lupus kind of fell under that category. So I knew what it was. I knew some drugs that were used to treat some of the symptoms, but really just did enough, to get by. Now, a lot of us all of us probably are familiar with the more, I don't like to say any condition is major or minor, but more common, like, high blood pressure, diabetes, asthma, COPD, we're familiar with all of those. So as a pharmacist working in a hospital setting, I see that every single day. 4 or 5, multiple people every day. So very familiar with the presentation, with the diagnosis, with the treatment. When it comes to lupus, we don't see that often. I would put lupus and sickle cell in the same category because we infrequently see cases of both. But when we do, we see them. When it comes to sickle cell, it's all about pain management when the patient is in pain crisis. So same thing like lupus. There's no, like with high blood pressure or diabetes, you got to take your insulin or your metformin. With high blood pressure, something you might be familiar with, lisinopril or Lasix for the fluid retention. So we're familiar with those, But when it comes to lupus, there are drugs that are more or less supportive, treat the complications and symptoms. And ultimately, it's not a cure because it's just really suppressing the underlying issue, which is the autoimmune system, attacking itself. So some things about lupus have been mentioned previously, so I'll just give you a brief overview. So what is lupus? Lupus is a chronic inflammatory autoimmune disease that can affect various parts of the body. I think we mentioned that earlier.